Is rectal bleeding a sign of hemorrhoids or colon cancer? Imagine noticing blood when you wipe after a bowel movement. It can be alarming, but understanding what it might mean is key. Rectal bleeding is a common symptom that can stem from different causes, including hemorrhoids and colon cancer. While both can cause bleeding, their characteristics and associated symptoms often differ, making medical evaluation essential for an accurate diagnosis. Hemorrhoids are swollen veins in the rectum or anus. They are very common, especially in adults over 50, and often linked to factors like straining during bowel movements, chronic constipation, pregnancy, or sitting for long periods. Bleeding from hemorrhoids usually appears as bright red blood, often seen on toilet paper or in the toilet bowl after a bowel movement. This bleeding is typically painless, although some people may experience discomfort, itching, or a lump near the anus. Hemorrhoids tend to improve with simple home remedies such as increasing fiber intake, using over-the-counter creams, or taking sitz baths. Colorectal cancer involves abnormal cell growth in the colon or rectum. Bleeding from colorectal cancer can also be bright red but may sometimes be darker or mixed with stool or even look tarry. And like hemorrhoid bleeding, cancer-related bleeding can happen at any time, not just during bowel movements. Other signs of colorectal cancer include persistent changes in bowel habits like diarrhea or constipation lasting more than a few days, abdominal pain or cramping, unexplained weight loss, fatigue, a sensation that the bowel is not fully emptying, or nausea and vomiting. These symptoms tend to persist or worsen over time and usually do not respond to typical hemorrhoid treatments. It is important to note that hemorrhoids do not cause colorectal cancer, and having hemorrhoids does not mean you will develop cancer. However, because symptoms can overlap, it is impossible to tell the difference based on symptoms alone. That is why seeing a healthcare professional is crucial if you experience rectal bleeding. Persistent bleeding, especially when accompanied by other concerning symptoms, warrants medical evaluation to rule out serious conditions like colorectal cancer. Screening tests such as colonoscopy are vital for maintaining colon health. They can detect early signs of cancer when treatment is most effective. The general recommendation is to start screening at age 45 or earlier if there is a family history or other risk factors. Regular screening can save lives by catching problems early before symptoms appear or worsen. In summary, rectal bleeding can be caused by hemorrhoids or colorectal cancer. Hemorrhoids are usually benign and resolve with simple measures, while colorectal cancer is more serious and may involve ongoing bleeding and other systemic symptoms. Because the consequences of missing a diagnosis are significant, anyone experiencing new or persistent rectal bleeding should consult a healthcare professional promptly. Early detection through proper screening and diagnosis is the best way to ensure effective treatment and better health outcomes. Always seek personalized medical advice for concerns about rectal bleeding or changes in bowel habits.